Hi, good afternoon. I'm Jinbert Lordson. This is Dr. Shafi. And we did this project along with the Department of Health, the Government of Kerala, and we are from Public Health Institute called Global Institute of Public Health. Dr. Tu.
Thank you, Jinbert. So we are happy to represent Dr. Anoop and the team which did this study over the last 1 year. So as mentioned, this study was looking at particular issue of a social media campaign, anti-vaccine campaigns, and also to explore like how our IEC strategies, the current IEC strategies were working. Okay, so the background, basically we did the study in this Kerala state of India, which is the southernmost state, which is widely known for its health at low cost and traditionally having a very good high coverage of immunization services. Even in the beginning of the 19th century, when the vaccines were available elsewhere in the West, we had the vaccination services. And we had very good indicators in terms of very low, even single-digit infant mortality rates and things. But slowly, over years, there have been problems in a decrease in coverage. Malappuram district, which is having a population of around 4.1 million, they already had a low coverage. But adding on to that, in the last 3-4 years, we are seeing an emerging increased resistance towards vaccination. This got a lot of attention in 2016 when we got a report of a lot of more than 100 diphtheria cases and with a couple of deaths. So when we look at the background in which the things were happening, like if you look at the implementation barriers, of course on one side we had an increased social media presence and utilization of internet services. But at the same time, our health workers who were traditionally trained to deal with positive health message in their routine work were not equipped to adequately respond to the negative campaigns. At the same time, when we say social media influencers, these are all like anecdotal, and there was no clear understanding on how it operates. What are the ways in which they get to operate? What are the messages that is being passed on? And there were a lot of underlying factors in terms of how these things, the new things operate. Traditionally, we know that the health workers were the main source of information for public on vaccination. Even when it was a largely patriarchal society, the health workers had an influence in the earlier stage, even though the religious groups and alternate practitioners, they had some presence. But with the coming of the social media, there were two-way channels. Some of the religious leaders who are big players started giving inputs to the social media on vaccine-related things, and alternate practitioners had their share in that. And of course, the smaller ones that started getting information from the same social media pool, and then it started influencing the decision-making in the families. The male members who decide on the vaccinations, they get more and more information from the social media rather than the traditional health workers stream. So that had bring in some changes in the way the decisions were made. So our objectives were broadly to understand the role of anti-vaccine social media campaign. What exactly is this campaign? How is it organized? Who are the players? What is the content? And on the other side, to see from, what is the strategies that we have, the information education communication strategy that was existing, whether it is able to counter or to manage this new menace of anti-vaccine messages. So we used largely qualitative methods, in-depth interviews, focus group discussions. We interviewed and had discussions with parents of children who were vaccinated and children who were not vaccinated. We had focus group discussions, in-depth interviews, key informant interviews with healthcare providers from the formal sector and informal sector, from the modern medicine stream and from the alternate streams and the religious heads. We did a review of the existing IEC materials, which we sourced from the field. We had two areas. One was a high coverage area, one was a low coverage area. We tried to find out the IEC materials existing in these areas, and also what the health workers are being trained or how equipped they are. And we did also the social media analysis or systematic ways of using particular keywords to find out what were the contents of the social media and what are the different type of social media, both from the perspective of the parents as well as what was available in the forums. So to summarize our key findings, what we found was that our IEC materials and handbooks, both those materials which were intended primarily for the public consumption, as well as those guidelines or handbooks for the healthcare workers, both of them were largely technical or general information. For example, the vaccine guidelines or handbooks for the staff, they contain information on like what vaccine to be used at what age and how to be stored and how to be transported, things like that. Whereas the IEC materials largely contain on where is this vaccine going to be available, what time is the session, and what diseases will be prevented by these vaccines. So it was a traditional positive campaign that was largely present in these materials rather than being able to counter or to answer the queries of the present day. Then, of course, there is an underlying past negative experiences of families, vaccine failures or side effects, which got accentuated with these campaigns because they could easily relate. Of course, this campaign also say about some of the side effects and the vaccine failures, and therefore the families could easily relate to whatever the rest they were saying. Okay, if this is true, the remaining may also be true. Then, as I said earlier, we operate on a very largely patriarchal society with religious leaders and alternate practitioners having some influence. And as I said, these people get on messages from the social media at one point, and some of the other members of the same groups will use these messages to propagate to the public as well. On the other hand, our health workers are not properly trained to sufficiently counter the propaganda. So for in meetings, in public forums and meetings and the parental meetings and all, when there are a lot of questions coming from the floor related to the messages, unfortunately, they are unable to answer properly to these messages. And the other aspect of our study was to looking into what is it in the social media message. So social media messages were either in the YouTube or the Facebook or in WhatsApp formats, but WhatsApp was the most popular and familiar one, even for the public. And the social media messages can be largely grouped into 3 or 4 items. One was on the content of the vaccine. So for example, they say, okay, the vaccine contain animal products, which are sometimes, some of these things are, maybe not acceptable for some of those communities. Or they may say about heavy metals being present in these vaccines. So, most of this information were sourced from the existing sources in the West, but was suitably tailor-made to suit the community in which they were operating. And another aspect which was contained in the social media, the materials, was about the side effects, like for example, infertility or cancers or autism, things like that, which were propagated. Another aspect was, generating fear in terms of, like, for example, again, depopulation. This is an attempt to depopulize particular communities. So it's very easy to penetrate these messages, which was used earlier in the polio campaign as well to some extent. And also, there were also attempts to raise suspicions, like, why do we need vaccines? When you are born with immunity, why do we need vaccines? Or, for example, saying, like, doctors do not vaccinate their kids. And, for example, those who are propagating vaccines have some benefit out of this. So, ultimately, what we find is that the health workers being unable to counter these messages with a very strong anti-vaccine campaign, there's an emerging trust deficit. So, our recommendation is to revise the communication strategy and tools for the changing needs of the time, incorporate the social media element, address the genuine concerns of parents on other side, and also at the same time, not explicitly but implicitly counter the ongoing fake campaigns. Initiate a social mobilization effort in this area, which is a high resistant area, like we did in polio. Influential leaders, political leaders, religious leaders who can be carefully selected to be involved in this process. Train our health workers for the new needs. New tools can be used for that, incorporating the demand raised by the social media campaign. And for that, permanently a social media cell can be set up at the state level to monitor and follow up and track the new things coming up and make information available for the health staff. From our study, we will disseminate our findings through district level and state level workshop. We also will be able to disseminate for the wider audience, because I think this is relevant in many countries at this moment. We propose to have an application developed, a mobile application, to help both the public and the health workers. They can use some keywords to search and find answers very easily, and also make some short video or audio clips which can be shared through WhatsApps in an easier shareable format, and also manuals like a question answer format for health workers, which can be used by them, very handy for them when they go for outreach sessions. And this is a classic case, like this is from the website of one of those persons who are behind or running a very big fake information campaign. And I think we need larger industry level regulations as well in that. Thank you.
Okay, thank you so much. Great job. Okay. Any comments or questions for the team? Anyone? Okay, Ngozi.
Very well done. It's a really good presentation, and I really, really like your application. I think that's really very good. The idea of developing a mobile app and having these short video or audio clips to counter these myths and propaganda, that's really good. Yeah, well done.
Thank you very much for the good presentation. Mine is generally a general comment, because we've had this kind of discussion back home, looking at especially the IEC materials at the different levels, because we have the primary, secondary, and tertiary IEC materials. And our biggest concern is that the primary IEC materials, which goes to the population. Now, how much information do we share actually with those primary audience? That's a very big question that we have. Should we go on and mention all the possible side effects that we anticipate with the vaccine, or should we say the good things? We need to find a balance of that. I don't know if what your comment is.
I think, yeah, you can finish it. Okay, this is very important aspect when you say like how much information to pass on, and it depends on some other factors. We believe, especially with a very high penetration of information and this sort of campaigns reaching very fast than we actually expect. I think there need to be some way of tackling this issue. At least for the health workers, they should be able to tell when the questions come. This is something which is a problem. Sometimes they go completely blank and they are unable to answer the questions because they are unaware of it. Because every time they are trained, they will be trained on the schedule. 0 day, the DPT, the BCG, then say 4 weeks, 6 weeks, 10 weeks. The same thing they are being trained. So I think there needs to be some more inputs into the training, at least for the health worker side.
Thank you so much. So I know you're still sort of these are sort of your initial data analysis, and I think you're still in the process of analyzing this further. And I think as you do that, something to think about for your recommendations is to really look at what are the particular messages and how, that information may be used to inform sort of your strategy and your way forward in a more detailed way, in the sense like, it's easy to say, revise, the IEC materials, but I think what your study is trying to do, and in your data analysis, exactly how those IEC materials are going to be improved and revised, based on what you learned. And I know this is still a work in process, so really great, for thinking about dissemination this early on, and this will be something that you continue to look at.
Yeah, thank you. And I think one important point here again is, as she rightly said, we are still to analyze from the system side some of the aspects. For example, what is our providers thinking of it? The analysis is still going on, because from initial what we have understood is that there is a denial mode. There is a blame and a denial mode, which we feel is may not be constructive. So we have to accept that there is an issue. It's not just because of some small groups playing around, but it's rather there's a system issue. And we have solutions like, revising the IEC, going in depth and doing it rather than doing it on a denial mode. I think this is something which is yet to come finally. Maybe it will have impact on our final results as well.
Thank you for a very beautiful presentation and, of course, focus. Ariel has actually mentioned some of the things that I wanted to in terms of looking at the objectives and, of course, what is really coming out of it in terms of course, analyzing and doing this thing. What you have in the applications are actually more like the medium through which you intend to actually counteract these messages. I think this is basically what it has actually been captured. But of course, looking at what you have actually identified in terms of these messages that are being circulated, one thing that is very clear, and of course, from programmatic viewpoint, has to be looked for. These people, this website that you just show, that are actually, they are doing it for a purpose, profit or whatever. Engaging them, and of course, everybody has a price. Instead of these messages, how can you engage them to be sending pro-vaccination messages rather than anti? And I know it will keep on coming, but of course, it's about selling yourself, getting their price, and let them be doing the work for you. Especially people are really getting into them. Thank you.
Yeah, I think there's a problem of search engine optimization in all this process. The problem is whenever you type vaccination in the Google or Yahoo, you have the first 10 results will always be anti-vaccine messages. Exactly. So that's a problem. And this one, I think there was a confusion. This is a person, I'm not naming anyone. It's a person who runs this anti-vaccine campaign, but his primary job is an alternate practitioner. These are the prices for his alternate practice, this alternate system practice consultation rates, not for anti-vaccine messages. So this is a business, you do this, you get attraction, you get attention, and you sell your products.
Yes. What I'm saying is that, the way Google works, if you
can engage them. If you can engage them.
Your products will be coming up early. Exactly. Whenever you make a search, for example, if it is a hotel you're looking for, who is dealing with Google? Google will make sure that their own hotels are the one cropping in early. The other ones will be downplayed. Things like that.
Yeah. I think it needs a larger intervention because.
Okay, Francis.
Okay. Thank you very much. I really admire your project. It's a wonderful project, and you've made a very good presentation. And I just want to make, actually, to add on what Ariel said, that since you're still at formative analysis level, you're still doing your analysis and you're capturing this information. We discussed this before, that gone are the days when we think we need to counteract bad messages, bad contra-health messages with traditional methods. That's not going to work. We need to come out and engage using technology. And my thinking, actually, my thinking is, it may not have been part of your study, but if there's a possibility, you could also put a kind of intelligence system. Because if you have an early warning system for these messages, if the message comes up, and even before answering it, there must be a team that's synthesizing this message and making sure, have intelligence, find out when the messages, even maybe when they're being generated, you could penetrate the systems and find out. So before the messages come out, you counteract them immediately, and then you can.
That's something which the social media cell can be able to do. There are some the technologies to track these messages. That's what we understand. So they should be doing that job. Yeah.
And maybe the other one, quickly, is also have information. When they bring out a wrong message, have the data to counteract that information with real evidence.
Absolutely.
Thank you so much for your presentation. I love your slides, and you are very clear in your presentation. I just wanted to, while they were discussing the other one, and actually the gentleman, you said it's a business, they actually pay for adverts. And I think also the Minister of Health can pay for adverts for the messages you're talking about. But what I wanted to actually suggest was during our presidential campaigns, I received a call from a number I don't understand, and when I pressed receive. It was the president talking to me in his voice.
This is everywhere now, it's
and
they are
I was
using it.
very happy to receive a call from the president. He was asking for my vote. Many Ugandans received them. Dr. Luze, you received, yeah? Yes. You didn't get? So we received the call from the president, and it was, I think, about 1 minute call.
Yeah.
It is
Recorded
possible to
messages,
actually
yeah.
get someone as
Recorded
high as that
messages, yeah.
to actually do those messages. But what I was thinking as well is that it's possible to actually create 30-second
Yeah.
30-second messages. Every time someone calls, that is the first
Good.
ringtone. Because I always listen to music I don't want to listen to when I call somebody. So it's possible actually to get that message on there
Yeah.
on the networks. It should be their corporate social
Yeah, yeah.
responsibility
Understand,
to give us some airtime to actually
Yeah, yeah.
promote
I agree.
short messages. Thank you.
Yeah, still back to the Google. One way that Google optimizes search is the information a lot of people look for often.
Yeah.
And so if people, as you have said, so many people look for anti-vaccine messages if you get a good number of advocates, pro-vaccine advocates, 1 million people to go online and search for something that is pro-vaccine, okay, it will start coming up, pro-vaccine message will come up more easily at Google search than the anti-vaccine messages.
No, the thing is, the BMJ study which I was quoting, the paper says even if you type vaccination and immunization, the first 10 results will be on anti-vaccination. It's not. Yeah.
So to add to that for search engines, so it depends on how many hits you get. So those anti-vaccination campaigns and whatever messages are getting more hits because it's more popular. So you will first have to make your messages more popular. But at the same time, when you do searches online, keywords are very important. So you have to not only pick the positive keywords like immunization, why it's good, but at the same time, target those anti-vaccine keywords so that when people search for that, your messages will still
Also
come
come
up. So that's my suggestion.
Thank you. Thank you.
Okay, any more questions for the team? Vinay?
It's not a question. I just wanted to add my voice to all the appreciation, appreciating your presentation. I think this was one of the presentations where you were actually able to clearly link your recommendations to your study objectives. That was very, very clear. Thank you very much.
Thank you.
Okay, great job, guys.